Hi everyone, let's look at a pig's heart dissection. Here's the anterior view, and here is the posterior view. Take note of the differences, and here is the superior view. We could see some of the main or great blood vessels. Here's the pulmonary trunk, and here is the aorta. You could also see some coronary arteries and veins and the surface of the heart musculature. And this is the right atrium and the left atrium. They're also known as auricle. And here are your right and left ventricles. Feel how the left ventricle is thicker than the right ventricle. Now you can make a frontal section starting from the apex. So be careful when you're carrying this out. Don't cut your own fingers. So in the video, this is a little bit fast forwarded to save some time. But if you're carrying out this dissection, make sure that you carry this out carefully. So frontal section means you're dividing an organ into its front and back halves. Again, take note of how the muscle is thicker in the left ventricle than in the right. You can also carry out some incisions so you could actually see the valves and the rest of the chamber. So again, right atrium, right ventricle, left atrium, and left ventricle. In between the right ventricle and left ventricle is a thick muscle wall, which is called your interventricular septum. Also got the left atrium and the right atrium being shown. You can trace where the ventricles meet the atria. Here's the tricuspid valve and the bicuspid valve. They prevent the backflow of blood between the atria and the ventricles. So this part is where the vena cava would have been. It's been cut away by the butchers already. And then in here is where the pulmonary veins would have been. They've been cut as well. So now we're carrying out some more incisions so we could see the valves more clearly. So again, on the right side of the heart, we have the tricuspid valve. This prevents the backflow of blood between the right atrium and the right ventricle. It has three cusps or flaps, hence the name tricuspid. On the left side, we have the bicuspid valve, also known as the mitral valve, that prevents the backflow of blood between your left atrium and your left ventricle. It only has two cusps or flaps of tissue. Now place your finger through the aorta and trace where the valve is. So its valve is known as the aortic semilunar valve. Semilunar because each section of the valve or each cusp is half a circle. This prevents the backflow of blood between the left ventricle and the aorta. And then find where the pulmonary trunk is again. You can trace using your finger, and you'll see the pulmonary semilunar valve, which prevents the backflow of blood between the right ventricle and the pulmonary trunk. You can make a section or a cut through the pulmonary trunk. And here we could see the thin flaps of tissue. That's your pulmonary semilunar valve. Now, let's take a closer look at the valves, and you could see that they're attached by string-like structures called chordae tendineae. and then these are attached in the papillary muscles. Okay, so your chordae tendineae and papillary muscles attach the valves to the musculature of the heart wall. So they help with the opening and closing of the valves as the heart contracts. Once you're done with your dissection, throw away the heart together with a brown paper into the designated rubbish bag.